Hello and welcome to all of our Gold Learning viewers from around the world. I'm Fiona Lang-Sharp, IBCLC Public Relations Manager and MC for Gold Learning. Well, welcome everyone. I have the pleasure of sitting down with Dr. Scott Siegel today, and he's going to be speaking at our upcoming symposium, the Gold Learning Online Symposium, Tongue-Tie Research and Implications. His presentation is titled Aerophagia Induced Reflux, AIR, associated with lip and tongue tie in breastfeeding infants. Wow, Scott, that's quite the title there. Welcome, and it's great to have you here.
Oh, thank you very much. Thank you very much.
Yeah, very excited to hear the latest information. This is something that I've looked at over the years, when I first started seeing the information coming out. And of course, lots of families are, there's lots of conversation, of course, about the tongue tie and, now the associated lip tie. So it's great to hear that. And of course, so many of our babies today are getting diagnosed with this reflux, and it just seems like we are in an epidemic. So I'm very grateful that you've been taking some time out to study this topic, so it's wonderful.
Well, it's been very exciting for me and a passion for me to see how we can help these families.
Absolutely, that's great. Well, let's back up a little bit here. So I would love it if you could introduce yourself today to our listening audience. Tell them a little bit about yourself and exactly why you wanted to talk about this topic.
Sure. Well, my background is kind of unique. I am both a physician and a dentist, essentially an oral and maxillofacial surgeon who specializes in essentially mouths, jaws, face, what we call orofacial growth and development, and airway. So a unique background. And going back from my medical school and surgical training, I had the fortune of being mentored by Dr. Elizabeth or Betty Carrillos, who was a major tongue-tie pioneer, and essentially took me under her wing and worked very closely together with her in private practice, and she kind of led me in this direction. So what really kind of helped me focus on this topic of a reflux, was dealing a large part with the medical community that I deal with, and getting referrals, for the breastfeeding infants. But along the way, over the past 16 years, really noticing that these babies, after having treatment for with frenotomies or frenectomies for breastfeeding problems, watching their reflux essentially disappear or be significantly lessened. And I felt that we really needed to try to get a further, more solid grasp on what was going on here. So that's really kind of the crux of my my research at this point, and one of the major areas of clinical and scientific research for me now.
Well, that's just fascinating, and it's great to hear. I mean, like I said, for your intro, with all these babies being diagnosed with reflux, the big concern is you see these tiny little ones who are already on medication, and of course, if we can identify and address those issues early on, it could be, essentially really changing the course of what has happened. And I'm sure you see plenty of babies that are already medicated at a very early age. It's quite overwhelming at times, when you hear those families that they've already had to undertake sort of a medication for their little one just to be able to sort of digest and keep their food down. So it's a great field, I have to say that. But I'd love to know, in your time that you've been studying this, and from the time that you were sort of, taken under Elizabeth, or Betty as you call her, wing, what have you seen change, and what has sort of really grasped your attention as things have changed over the last few years?
I think, one of the biggest things I've really watched and appreciated was the coming together of specialties in multiple fields, and not only, across lifespans of individuals now. So really kind of trying to garner an understanding of tethered oral tissues and its impact in, from infancy through adulthood, and really understanding and essentially connecting these dots now, understanding the impacts on orofacial growth and development, feeding, airway, and its impact on the whole body and the whole system, which really, being active and looking and dealing with other specialists and doing research in other areas, I think it's really been, for me, it's been a wonderful eye-opener to watch these develop very quickly too. So I think that has been the broadest, development, I guess, if you might call it a development in this field. That's been really interesting for me.
Yeah, I couldn't agree with you more. And it is absolutely true. There's been people coming together. There's been lots of conversation, discussion, disagreements, which I think is absolutely brilliant because when when you're not agreeing, it just means that you have to go back and do some more research, which is really where you start to see growth. And so I love that too. I love the way that, we're able to have, I mean, years ago, we never saw, symposiums or conferences about tongue tie, and now, we're seeing them. And of course, that was why, we were very driven here, of course, at Gold to make sure that we could get this information out. So yeah, that really is a good thing. So thanks for sharing that point of view too. That's really great. Well, lastly, before I let you go today, Scott, would you just perhaps share with our Gold Learning delegates, what are you hoping that they get out of your presentation as they listen in on the day to you?
I think it's more or less the biggest things I always want people to come away from when I speak about this topic is that we still have more questions than answers. So really trying to maintain an open mind and understanding connections, either anatomic and functional connections, and I try to keep things on a more simplistic level. And trying to keep things simple. So there seems to be a correlation here between tongue and lip tie and essentially swallowing air and reflux. There's still a lot more research that needs to be done, but I think it's coming away from the presentation. You should have some sort of understanding of maybe some of the pathophysiology of reflux in general, although it's still a very poorly studied subject in general. And I think it's just more or less the opening of people's eyes and minds, essentially, to think that there might be connections to other things in the infants and growing children.
Well, thank you so much, especially speaking to that about having open minds, right? Very important in this area because
absolutely.
Still very, like you said, under research, we're still growing, we're still learning, and there's still a story to be told here. So it'll be great. Thank you so much. I'm looking forward to hearing more. I've had a little bit of a sneak peek, of course, of your presentation, but I have to tell our listening in delegates today, you're in for a treat. I know that Dr. Siegel here has got lots of information for you. So please join us for the Gold Learning Online Symposium, Tongue Tie Research and Implications, November 15th, 2016. You can find all the information on our website. And thank you so much, Scott, for being with us here today.
Thank you.
It's been great chatting with you.
Likewise, looking forward to sharing.
Thank you. And thanks to our listening audience.